Family planning often is misinterpreted, misrepresented, or even misunderstood and taken out of context for many reasons. Some even include it as, say, for political reasons. But let's put this in proper perspective. Family planning, according to experts, can be a strategic tool for achieving our national development plan goals and objectives for a robust, impactful national population plan. That is, planning with the people within the resources available. You plan your population growth and tie them to your available resources, and some measure of equity can be established. So today, that is where we are going on bridges. Family planning in all its ramification. Because just recently, Nigeria hosted the eighth National Family Planning Program. And of course, Bridges was invited. And we thought that this should be a conversation that should continue so as to reduce the misconception around family planning. And so, well, as we look forward to renewed hope and indeed achieving equitable development where no one is left behind. On that premise, I have with me Dr. Mariam Olaide Jago. Dr. Jago, you're welcome here, but a little insight about her. She's a seasoned public health leader and medical doctor with over 25 years experience in clinical medicine, program leadership, and health sector management. She has a proven track record in leading impactful programs, fostering partnerships, and scaling innovations in global health. It's good to have you here.
Thank you very much.
Yes.
It's a pleasure being here.
Yes. So we're looking at family planning in all its ramification, and oftentimes there's a misconception about family planning. What has been your experience, especially in the field of in the space of reproductive health?
Yes, let me first say that family planning is a way of aligning your fertility intentions with the actual fertility. So it's the intention of women, to have children, the number of children they actually have in terms of spacing and timing. So it's not necessarily that you have to have 4 children, but how many children can your health actually take, based on, the reality of time. And that's what family planning is preaching. But most times is misunderstood, is misinterpreted. Because one, there are so many myths and misconceptions, when you go to the community about family planning. People feel that family planning, they equate it with infertility. Sometimes it's like you're trying to plan their family, that what rights do you have to want to plan people's families? But so that's the misconception they usually have. Also, there's access to family planning in some communities. In some communities, where they can actually access family planning, it's in terms of physical access, it's quite far. There's physical access, there's religious aspect of it. Also, some religion don't believe that, you have the right to plan people's family, that people marry because of procreation. So these are all the things, around family planning. But family planning has a health component of it, in which before you can initiate another pregnancy, you need to have recuperated. Because with each pregnancy, you lose water, you lose blood. There's an emotional aspect of it also. So you need to have, recuperated to the pre-pregnancy state before you can achieve some other pregnancy, in which people don't know. The least is 2 years before you can achieve another pregnancy, can start getting pregnant again. So because of the misconception, because also people think that, the family planning methods, they don't really understand it in some instances. And sometimes also when they go to the medical facilities, the health worker would take time. It takes time to counsel a woman about the different family methods so that she can take her decision to choose a family planning method. So these are all the things around family planning that is misinterpreted, misunderstood, and women, once they probably have a side effect of it, maybe bleeding or headaches, they believe that something within them is going wrong. Yeah.
So yes.
That's all the issues that we have. Then the political one that you said, yes, because most times allocation to states are always based on their population. So most also, the states may feel that you need quality rather than quantity, and you need quantity rather than quality, for you to be able to operate and get allocation sometimes. So those are things that, are against family planning in a way. But I can tell you, family planning is a tool, to economic development.
Mm. Well, we both agree on that. Yes. So that's the bridge that we intend to build today, and hoping that we can build on a very sustainable level, especially when it concerns family. Now, you're talking about, the health implication for the woman who carries the pregnancy, and after that, go ahead to the need for her to space the time before the next pregnancy comes. What about the men? What should they know? What is the bridge we should be building to carry, because it takes two anyway to tango, so they say.
Yeah, and that's, one of the things we are preaching now, so that there should be male involvement in it. I think maybe the early times also, the focus was on the woman because she's the one carrying the pregnancy, she's the one the burden will be on, without realizing that, at least men take decisions, in some societies or even almost all the societies. So now, and we've realized that, and the focus now is on the men to actually realize it. Apart from men also being engaged in, taking a decision about family planning, it's also men, they have also options in which they can actually take. There's the male condom, there's a vasectomy, in which, probably is a contentious issue. But
Very.
they also have, they have a family planning option also to take, and also to encourage their women, most especially their women, their girls, their children, their, to also be able to take the benefit and get a family planning method.
So what exactly are the gains out there for family planning that we need to speak to? And what would you say the summit achieved moving forward and fast tracking? Should we use the word acceptance or the usage of family planning as a development tool?
Okay, so first is let's understand family planning. Yes, family planning is a health issue. It's making the woman healthy, you understand, so that she doesn't achieve pregnancy in quick succession. But also, family planning is about empowerment of the woman, because if a woman delays her pregnancy, or she can have pregnancy when she decides and has autonomy over her body to be pregnant, she can also have time to decide about her life. She can have time to take care of the existing children. She can have time to also focus on her means of livelihood. You understand? And again, we shouldn't see family planning as the end. That once family planning, it's you do family planning, then that's the end. That's where you're trying to achieve 27%. No, it's also a tool to economic prosperity in Nigeria. You understand? And when we come together, for the family planning conference, what we are doing, we're bringing people, all stakeholders together, government, international partners, donors, health workers, community people. We are bringing them together to learn. So it's a south to south learning. It's also reflecting on all our gains on family planning. If you look at what we have now, for the new NDHS 2023 that will soon officially be released, we've not made much gain in it. When I did a back of the envelope calculation, we made about 27,000 in each, if we divide it across the states equally, which may not be equal. We made 27,000 over 5 years for additional women to actually do family planning. You see that is a minute number for us to actually make impact. So we've not really made impacts in it. So when we come together in the conference, we are reflecting on an achievement. We can say that all we have been doing, that's where it has gotten us to, but we need to be radical moving forward. So reflect on us, we now determine what are our challenges and what are the paths that we should take towards reaching our goals. So that's what the family planning is all about. And from the family planning, the gains we had is that we need to bring also more private sector into it. Apart from them, doing corporate social responsibility, business should be transactional. How can they benefit from what we're doing, and also we benefit from what they're doing? How can they invest more, in family planning? Then most especially is thinking about domestic funding, because a lot of times, relied on donor funding. And donor has their priorities. Things are
Certainly.
changing. Even globally, there is a global crisis. So the money coming to family planning now is not much, especially to the commodities. And when we say family planning, we say commodities. No commodities, no family
New
planning.
family
And
planning.
over the years, we've been seeing gaps, in the amount of money coming to commodities. So we now have to look inwards to see how we can actually get more money into
Yeah,
place.
I'd like to take you up on that, looking inwards. Because oftentimes when you talk about family planning and you said, okay, funding is needed, people say that we have other priorities outside family planning. So how, I would just want you to be very deliberate in letting our viewers understand, particularly now that there's need to have more hands on deck, to get commodities available. Why is it that family planning needs more funding?
Okay, so why family planning needs more funding is something that can give us economic prosperity. There's what we call demographic dividend.
Dividend.
And that is what we should be moving to. And it's a generational thing. It's a one opportunity that you can get in one generation. Because what we have now, we have a bloat of a youthful, population. And if we don't make use of it now, if this generation passes, we are going to actually lose it. So what we have now is increase in fertility. So the number of the working population is actually less than the dependents. We have 70% of our population being youthful population. So it's only a very small fraction that is the working population. So most of the amounts they get when they work, they spend it on their dependents. So we have to reduce the dependents, increase the working population, and that is the beginning of demographic dividend. So how we can do that is to reduce fertility. And the only way we can reduce fertility is, one, improve our family planning methods so that a lot more women can use family planning method. Then two is also women education and improve our health system. If we don't improve our health system and there's still increased fertility rates, women will want to have more children because they believe that some will die before they attain a particular age. So once we are able to achieve those three, then we bring down the population, we increase the working population and reduce the dependent. That is the beginning of demographic dividend. But before we can reach that, it's not a passive thing. We have to actively also do some other things, in which South Korea did in the 60s, and they begin to see the results in the 80s and 90s. So it's not for one government to do, it's to have a collective vision that we're going to do it. So they have to focus more on education, they have to focus on infrastructure, they have to make sure that it's easy to do business in Nigeria, and they also have to focus on the health system so that we have a healthy welfare. So once we're able to do that, you see that the population that we have now, that is youth population, over time, they'll be employable and they can employ people. And they'll also be skilled. Once they do that, it increases, the economic benefits. So there's more money that the family, the community can also get in taking care of their children and also in savings. And government also on the other side would be able to save the money they would have spent in having more children in school, more children in the health system to do other things, for it. So that's where, the economic benefits come into place. And it takes about 20 years to do it, but we have to take the opportunity now. And that is why we say that family planning goes beyond health. There's some social determinants to it. So the education also has to be involved in this. Agriculture also has to be involved in this. Infrastructure has to also be in place for us to be able to enjoy it. So the government has to know this. We have to preach this. We have to evangelize this so that people know that, look, it's beyond health. You might think that family planning is just about planning families, but family planning is about the whole gamut
of national development
and prosperity.
And prosperity. Well, I like that prosperity part of it. Yes.
It's true.
Because it's true and it works. You were talking about Korea, and I just wanted you to expand on it so that people can know that it has worked elsewhere. It can work here too. Because when you look at the population rate in terms of what Korea has and what we have, there's a whole lot of similarity. What has been their gains in the last 20 years that we need? Do we really have 20 years?
Well, the journey of 1,000 years starts in a day. South Korea in the 60s, and also Thailand, China, and some other countries have also done it. So we can do it. It's possible for us. So South Korea, they went through war in the 60s. So post-war, they were able to focus. The government was able to be deliberate because they know that, they have to be intentional in what they do. So they focus on bringing down the population. So what they did was they reduced the fertility rates initially, and how they reduced fertility was just what I discussed earlier on. They make sure that they put an effective family planning in place. High impact practices. They had good family planning programs in which every woman was actually rich. No woman was left behind. And the other thing is also to focus on women education. When women are educated, they're able to know more about the family planning methods. They're able to be empowered. Then the third thing is also to make sure that the health system works. Once the health system works, I'm really assured that when I have my 3 children, there's nothing that's going to take them away from me when they grow up. All child survival activities are in place. Malaria, nutrition, immunization, all those things are in place for children. So there's less the reduced infant mortality rate. So once you do that, children will live beyond 5 years. They will live to 14 and beyond that. So women are rest assured. So they have very smaller families. So then you're able to now reduce the dependent population in it and increase, the working population. So once you do that, you have a working population that is, moving towards prosperity. Then it doesn't stand at that, like I said. They also make sure that the health system is functional. They also make that people the youth are engaged and they're working and they're skilled, in the job for the future. Then also is putting all infrastructure in place. Infrastructure,
Very
electricity, water, housing, everything is
sanitation.
put into place. So once that is put into place, then
you're very optimistic about this. It is doable, is workable here.
Yes, it's
a bridge you can build.
Yes, it's workable, and really, really, like I say, personally, I'm passionate about it, and I encourage that everybody. That's a call to action within your space. What can you really do to make sure that you move women forward, you empower women, and we also have to get the political will. We need to talk to the government. It's not something about activism. So it's about lobbying, it's about advocacy, it's about making them see reason why they're going to do this. Because they're women. Everybody has a woman in place. It's either your mother, your child, your wife. You have someone. So what future do you have for your children? What future do you have for your cousins? What future do you have for the girl around you? So that's what this is all about. So we must see a collective vision in Nigeria that we need to improve family planning services.
We need to improve family planning services. And you're very emphatic about the fact that it's a collaborative thing, partnership thing. Looking at a PPP thing. Now, if you're talking to, let's build a bridge for the private sector to come on and be part of this, well, I would call it a movement. Yeah. What would you be saying to them?
So thank you very much. So there's different angles when it actually comes to the private sector. One, it's women working in your organization. The less frequently they get pregnant, the more they're able to work. They learn to spend more money on when they get pregnant, when they have babies, they take maternity leave. So the less you spend on maternity leave, the less you spend on them actually going to clinics. So it's a benefit to them in that way. Also, as a corporate social responsibility, it reduces your tax. So you need to do it in some way. But apart from also giving handouts to us, we can also sit down and think. For people, for instance, doing sanitary towels. The more you sell your when people are on family planning, then you sell more of your sanitary towels. So it's also transactional. So it's economic gain also for them in that way. So we should also see it as an economic gain for them. People selling products, you can, probably have an advert, a small advert or sticker on your products, promoting family planning. It's obviously something they can do. They can also give money for us to buy, commodities in a way. So there's a whole lot, the private sector, people in the private sector do. And also when you not talk about the private health facilities, they can be trained in family planning. We're looking for a way we are going to build community awareness in it, that everybody that goes into the health facility, the last thing they ask when they're going is just when you get to the till and you see all those products in stills, do you have this? So that's what we're trying to build, and that's what I think government should actually also focus on. So for the private sector, there's a wide array of what they can do. They can help us in promotion if they have products that goes out. They can also help in probably contributing to the basket funds in buying commodities. They can also encourage family planning within their workspace, so that the women in their workspace, one, they take up the family planning methods, and they're also champions in making sure that others around them believe in family planning. Yeah. What I say, is like, I want family planning to be like Coca-Cola, to be like Maggie Cubes, or what they sell within their house.
Wow.
Yeah, so that when you move from generation, you don't have to preach again.
Everybody's aware. It's there.
Yeah. Well, so that's what I'm expecting to be.
Yes. Good one. Now, I was going to say that we also have traditional and cultural barriers. How is this going to be surmounted?
Yeah, okay. So what I said is that, brought all stakeholders. For the conference, we didn't elaborate more on the conference. We had pre-conferences in which there was interfaith, there was a youth group, and there was a women group, because we believe that, these are all the people that we need to address for us to be able, to make a mark in family planning, to move the needle when it comes to family planning. So for the faith groups, we're bringing them, and also the traditional groups. There are gatekeepers. There are people within the community people believe in, they rely on. And also when it comes to our cultural values, they hold on to it. So we're bringing them to make them understand the values, the benefits.
Has there been gains along that line?
Yes, there have been gains, and the books have been developed, when it comes to the religious aspect of it, to actually make sure that, within the holy books, both the Quran and the Bible, there are verses in it that, that support family planning. So we're going to be using that to now preach to them. So we want them during every opportunity they have, whether they're in the mosque on Friday, on the church on Sunday, to preach about it. Even when they go out on special events, maybe naming ceremony, and
Our cultural
churches,
thing,
cultural
the
days.
season, for example.
Believe me, it's something that they can also, preach. And for the traditional people, they're already well on board. You understand about it, to make sure that at least within the community in which they live, women, girls, men, and everybody within there, they're able to take informed decision when it comes to family planning methods.
Very important, informed decision. That's what we're trying to do here. Now, we're looking at the whole gamut of family planning and seeing it within, the lens of economic development. Let's go back to the very basis when we're talking about the health of the woman. I think it's also very important for us to re-echo that here, because really is a woman who would want, especially that in our society we still have polygamy, and women see the number of children that you have as well, there's a competition out there. So, Dr. Mariam, what are you telling our women? Well, at least we're still within the scope of the 16-day activism. So let's chip this in as well.
Yeah, it's. I think women should first say that it's my life. You understand, and I'll have to live it well. And, I have to be healthy. One, to take care of myself and make sure that I'm also important to the family. I can, also contribute to the economy of the family. Then two is that they have existing children they have to take care of. If you don't take care of your children, nobody will take care of them for you. So you have to also live because your children are there. So it's not the number of children, it's not by quantity, it's by quality of children that you actually produce. We've seen women also, grow up to be, important people in the society. They are celebrities. People are holding positions. Look at Ngozi. Ngozi Okonjo-Iweala, she's
Amina
there.
Mohammed.
Muhammad Ahmed.
Dr. Maria Jago.
So, people are there. I don't think there's any profession in this world that you can't see a woman actually coming there. Look at, you're doing beautifully well.
Thank you.
I'm sure a lot of people, when they grow up, they want to be like you. You're still grow up and, still working. So it's not about whether you have a male child or you have a female child. It's what you're able to instill in them and how you're able to develop them over time. So I think women should take this. They should take this rule that it is my life. You can't have a pregnancy now. You have lost about liters of blood. You have lost blood. You have lost water. It takes time for you to recuperate this. The more you do this, the more you're, charting your path to losing your life. And when you lose your life, or maybe you lose the child coming in, it's the life of the child and even the life of the child that is coming up apart from your own life. Because you can't have premature children when you have pregnancy in quick succession. So you need to give gaps when you have your children. So we're not telling them, we're determining that, have 2 children, have 3 children, but is have the number of children that health-wise, space them well, that, health-wise, it's good for you. Economically wise, also in some instance that you can also put instill religion inside them. So that's what we're all talking about.
Right. Well, so interesting. This is the conversation. I can assure you, viewers, that will continue. But we want to thank you so much for coming on. As you leave the set, give us a final word.
So I will say that, we shouldn't take family planning as a health issue. It goes beyond health. When we be able to make sure that people plan their families, an economic tool that we can use in economic prosperity in Nigeria. So everybody should become on board. It's not just an health issue. There are also social determinants that are involved in health. There's the education, there's agriculture, there's infrastructure. All those things need to be put in place for us to be having a complete woman, over time. So I think government, traditional leaders, faith leaders, individuals, families, all should come on board and let's all be champions when it comes to family planning programming in Nigeria.
Well, you can depend on Bridges, who will continue.
I trust you. You're always there. You're always there for us.
We'll continue to champion all the strategic tools that help to build a healthy herd of Nigerians who can transform the country to the dream country that we know we can achieve. And doing that means that we must have healthy mothers, healthy children, healthy fathers, and of course, a society with the kind of infrastructure that will make us grow and stand us tall among community of nations. Thank you so much for coming. I'm sure we'll have you again.
Yeah, thank you very much.
Right. Well, viewers, that's all time will permit on Bridges today. We thank you for watching, and we hope that you have made a champion of family planning from you watching. Spread the news, make our world a better place. We'll see you same time next week. Thanks for watching.